We're good to go. Good afternoon, and thanks for joining us for School-Based Health, Combating the Drug Crisis. I am Kelly Caseman, Executive Director of Think Kids, and we're going to spend the next hour talking to staff from Cabin Creek Health Systems and Kanawha County Nurse, and they'll introduce themselves in a minute, who work in leadership or as providers in their school-based health centers to discuss the role they play in addressing the needs of children and adolescents affected by the drug crisis. We have lots of ground to cover during this hour, so if you have any questions at any time, please feel free to type them in the comments below, and we'll get to them during the conversation. So let's start off with introductions. Let's start with Mary.
My name's Mary Grandon, and I'm a physician assistant that currently works for Cabin Creek Health Systems at Hoover High School, Elkview Middle School, and Glendon and Bridge Elementary.
Thanks, and let's go to Margie.
Hi, I'm Margie O'Kelly. I am a psychologist, and I also work for Cabin Creek, providing behavioral health services at Herbert Hoover High School, Elkview Middle, and Glendon and Bridge Elementary.
Thanks, Margie. And then Lori.
Hi, I'm Lori Haapala. I'm a Kanawha County school nurse. I work at Pinch Elementary and Elkview Middle School.
Well, thank you all three. I'm going to pull that down, and then we'll start with some basics. So what is a school-based health center?
A lifesaver. For a school nurse, it's a lifesaver to have a school-based health center that we have access to, especially with behavioral health.
Mary, you want to give a textbook
Yes.
definition? Great.
So, well, I don't know if it's exactly textbook, but school-based health centers are primary care medical centers that are located within the school-based setting. So we can provide through Cabin Creek, instead of being in one of the main health centers, we're a team that comes into the school and is located within the school to provide all the same types of medical care that you would get at your family doctors. Or so you get your immunizations, you can get your well child, you can get sick visits, you can get strep testing, you can get pretty much the same types of services that you can get, except we come to you instead of them having to come to us. And then in our school-based health centers, we also provide behavioral health services too.
Gotcha. So not every school-based health center has mental health care, but Cabin Creeks do, correct? And
Yes.
That's where
Because-
it comes in.
Yes. We feel like that you need to treat the whole child, because sometimes some physical ailments aren't necessarily from a physical source necessarily. They sometimes come from a psychological problem. Maybe the child's feeling a little sad and down and they can't figure out how to tell somebody that. They haven't figured out what that emotion is. So that's where school-based psychologists come in and can help us work with the child as well.
Great. So let's talk a little bit about the history of Cabin Creek School-Based Health Center, Cabin Creek Health Systems, school-based health centers, and then we'll talk about that connection with Lori and the school nurse. So, Mary, you've been with Cabin Creek for a while now. I can't remember if you were there when school-based health centers actually started. That may have been a long time ago, but can you tell us about kind of your initiation and evolution of school-based health?
So within Cabin Creek, when I've been with Cabin Creek now 15 years this year. So 15 years when I started with Cabin Creek, they only had one school-based health center. That school-based health center had been previously run by a different organization. And then it was taken or bought out by Cabin Creek. So they had only had it maybe, I think, 3 years before I came to join the organization. And at that point, they were trying to figure out how to expand school-based and do more services. So in the evolution of school-based, we had only medical services provided, and it was at Riverside High School. And that one was both a community center and a school-based health center co-located in one. So there was an entrance for community to come and see providers there, as well as for school children to come and access providers in the school-based health centers. We did not at that time have mental health services, but over the evolution of school-based, there was felt to be a need for mental health services. The more we dealt with children, the more we saw families struggling, especially as communities lost resources. Coal mining in West Virginia went away. So the area over where Riverside's located was a huge coal mining community. So that truly impacted that entire community. We then were asked to come and join East Bank Middle School. They're a feeder school into Riverside. So we then began to provide services there. Their first need was mental health. But like I said earlier, I feel like mental health and physical health go together. So we took the entire team over to East Bank Middle School. And then we slowly evolved into Sissonville High School, then Herbert Hoover High School. Then then it was Clendenin Bridge, or actually Clendenin Elementary. And then in 2016, when things flooded here on the Elk River, and Herbert Hoover then became co-located on the Elkview Middle School parking lot, and Clendenin Elementary moved down into Bridge Elementary, we began to provide services to all of those schools since we were co-located right here with all of them within just a mile or so radius.
So you would say that it was the need for school-based health comes from a number of things, but one of them is it's easier, it's more accessibility. You know, sometimes parents work and then and they just don't have the opportunity to take their kids, so it's a convenience. But then you also have over the years a downturn in our economy, and so it's a way to provide health care for kids who may not be able to, the family may not be able to afford it if they didn't have that school-based health center there, or they can't get off work. And then what we're going to talk about in a little bit is the drug crisis, which may be one of the reasons that you've seen such a steady interest in more mental health services in your school-based health centers.
Yes, as our communities have had the downturn, that has gone up. And other reasons parents may not be able to access healthcare is transportation, which as the economy has downturned, we have more and more families without transportation.
Right. And we're not really seeing a robust network of providers for families to see. So Lori, let's talk a little bit about the role of the school nurse and how that is different than a school-based health center.
Well, the school nurse usually sees the child first and uses the school-based health center as a resource. They come to me usually with the psychosomatic symptoms, and after a few times, I can refer them over to see Mary and Margie or to the school-based health center. It's also something I use all the time for immunizations, to be caught up, strep testing for children that cannot get to the doctor, like Mary said, because of transportation, because of the drug crisis. So many parents just aren't taking care of their children the way they used to, or we have grandparents. So many children, our students, are being raised by grandparents. And so it's harder for them to go to the doctor. And it's just so nice if I can call and say, you know, I think your student has strep. Do you care? Can I send them over to the school-based health center and they can get tested and get a prescription, and it's all taken care of for them. So it is a convenience, but it's just such a great community resource. And I just feel very lucky to have them to work with.
Awesome. So let's go one by one and talk about what, this may be hard for Margie, what work was like kind of pre-opioid crisis, or when you started the work, and then what it's like now. What is the difference of what perhaps you're seeing or what the school is experiencing? Maybe we should start with Mary for that one. Mary, do you want to go first?
Yeah, sorry, we're having announcements for the school right now, so I was kind of waiting until that ended, and he's not quite done yet.
Let's go with someone else. Margie, let's go with you first. Are you in this? Okay, great.
Yeah, I'm in the same building, but the announcements have stopped now. So, so I've been working here at Cabin Creek for 5 years. Sorry, they're kicking back up again.
Lori, are you in the same building?
No, I'm not.
That was Lori.
Okay. I'm sorry. What was the question again?
So the question is, what was kind of the needs of students before the opioid crisis as opposed to now? Do you see a difference in the healthcare needs of students?
I think there are more mental health needs since COVID and having us out of school for as long as we were. It was very hard on a lot of our students. So that has definitely increased. It's just all been so strange and so weird. Kids aren't getting their immunizations like they need. They're not having their well childs. They're not even going to the doctor sometimes when they're sick. So we have a lot of catching up to do.
So you're talking specifically post-pandemic, correct?
Right.
Okay. Yeah, so this is a real question that a number of us have been having as to what is going to be the need of kids when they come back to school full time, and we're kind of looking at a post-pandemic world. And you're saying that just getting them back into the swing of getting your vaccinations, getting your well child exam, visiting the doctor is needed. That's kind of a challenge right now.
And being away from their peers for so long has had a huge effect on many of our students. I'm sorry, I was texting someone about blood sugars at the same time.
That's okay. That's your job. So we totally understand. Okay, let's go back to Mary. Pre and post, what have you seen?
Pre and post opioid.
Yes. Yeah.
So I think each community has been a little bit different. Pre-opioid crisis, I didn't find as much not bringing them to the doctor, taking care of medical necessities, immunizations. Parents seem to be more engaged. Like I could find parents when I called them on the phone. I could, track down. I didn't necessarily have to look at the emergency card to figure out who to call because there was a parent somewhere that I could access. I think as the opioid crisis has evolved and I've watched communities kind of deteriorate, I now have children who aren't living.
Mayor Palmer and Caleb Hackney report to the office, please. And Mayor.
I've not seen children that are all now living with parents. Like it used to be that I would only see a few children who were like in high school that were couch surfing, who would go from family to family to family. Then it became more children and it became younger children and it became whole families who were displaced or who were now living over here with grandparents, and grandparents were trying to figure out how to be parents again, or great grandparents were trying to figure out how to be parents and they hadn't been parents for years. So they were trying to figure out technology because they didn't know anything about how, a child needed to log on to an iPad or onto something for a class. And grandparents were like, I don't even know how to do that. Like, what is that math they're learning? So I think things were so different as we have progressed through this. It's just deterioration of the family and of what we had previously had. Children are more in crisis. Their anxiety levels seem to be a little bit higher. They don't know how to tell you all the time what's going on with them. So we're seeing more things in classrooms. We're seeing more outbursts of behaviors. It's just the gamut of everything that you see when you take away all of those nurturing and positive influences. More and more trauma.
Thank you. Margie, you want to?
Yeah, I just kind of want to echo everything that Mary said. I've been in this role for 5 years. And one of the things I've noticed over the course of time, when I first started at the high school level, we had a lot of students who were affected by the opioid crisis, and who had a lot of instability in their lives, but they had at least had some stability maybe in their younger years. And so as time has passed, I think I've seen more like severity in the presentation of the behaviors and the emotional issues that students have. And it kind of correlates with longer and longer exposure, the bigger portions of their life being kind of in chaos, not having a lot of predictability, like in terms of where they're living, having CPS coming in and out of their lives. And with some of the younger students, I think even sorting out, how much of attention problems and behavior problems and learning problems are potentially prenatal exposure issues versus, repeated trauma through early childhood. I mean, it's really, the issues are a lot more complex. And so as time has passed, even though I was kind of here after the opioid crisis kind of started, I think I've seen increasing severity and how it's presenting just because of the duration of how much that has affected kids over time.
No, I agree. I was just thinking, I remember I met Mary, 15 years ago, maybe. And then Lori, it was maybe 10 years ago. And with Mary, one of the first things that we worked on was chronic disease management, and it was obesity and nutrition, physical activity. And then with Lori, one of the first conversations we talked about was around chronic disease management and trying to get backpacks of information and some equipment to kids who have been recently diagnosed with diabetes. And then I think of how far we've come since those conversations. I mean, Lori, I remember the last conversation you and I had over coffee was concern that you had about students who lost close parents to overdose over the summer and what their support system would look like during that time. So it seems so different to me.
It does, and it has just increased. It seems like every year there are just more and more children that we have to make a connection with because of the drug crisis. And I know we all worry about them over the summer when they leave us, or finding out, like you said, that a parent has overdosed and died over the summer, and who is with them and who's taking care of them and what are their support systems, and will they be back with us next year so that we know them and can, help take care of them, or are they going to be taken to a foster home somewhere else?
Right. Right. So do you see a lot of kids who are transients where they may leave and then come back, whether that be foster care or residential care?
All the time. And a lot of our families move all the time because of the opioid crisis. They're very transient, and I never get rid of a student's folder because I just know they're probably going to be back eventually. So, but we do see a lot of kids from the foster system, and they'll be there a couple of weeks and then they're gone. Sometimes they stay longer, and we can make contact with them and get them over to the health center for what they need.
And just to clarify, to get into the weeds just a little bit. So, because Mary, I remember us having this conversation a few years ago. Sometimes you have kids who come in and they assume that you have access to all their medical records. And so there's real kind of fragmentation as to their continuity of healthcare as they move.
There is, because kids will go off into foster care somewhere or go off into a placement, and then I may not even know everything that's happened to them in the process. And then all of a sudden I'll get them back and try to figure out what medicines they need because now they're here. And so it's calling pharmacies, tracking down who they saw, because sometimes when they're in a placement or somewhere, they don't know where they were. They don't know who they saw. So it's really hard. There's no system to be able to go and say, oh, look, The electronic system has helped in some ways. It has been able to, so at least if a child filled the medication in a pharmacy recently, I can at least get that from the system. But other than that, I don't get records as to what happened or who saw them or what they were diagnosed with or what testing they may have had done. And it's difficult for the school because if I don't have it, they don't have it. Nobody knows. They just show back up. And it's like, do we have an intervention? Do we have a plan? Do we know, is there an accommodation I need to do if something happens? What could be the side effects to this medicine that you're on right now? So yeah, it can be kind of challenging for them just to show back up, but that's what happens in our system.
Unfortunately, the only record we get from school to school is usually their IEP, which is more their educational plan. So we don't have any background as far as medications or any type of behavioral health unless it's addressed in the IEP. And for some reason, school nurses don't even have access to the IEPs in our Weavis site. So it's very hard to know what's going on with these kids.
So it would be very hard to not only provide healthcare, but to teach them as well. So here's a question for those who may be watching who are not accustomed to working in the healthcare system or perhaps with children and adolescents. How can familial substance use disorder have adverse effects on the health of children in the home? So you had mentioned lack of stability is one. Overdose is another.
Yeah, lack of stability, just the continued trauma. Right? If there's domestic violence that has come about from the substance use, if they were exposed in utero to these substances, what type of learning problems or things might they have? They might do well in the beginning stages because in elementary schools, we're really good about fostering kids and giving them that extra help. But then when they hit middle schools and high schools, they tend to fall behind. We expect a lot from them. And if we're not aware that some of this transpired, like their brain has not developed exactly like everybody else's brain, then what? And we aren't set up to, in our society or here, to be able to tackle some of that. Like there's no classes to help those type of children. If they are behind, there's not really a place within the school system for those kids to go. They may not necessarily be behavior disordered, or they may not quite meet special education requirements because they're in this middle ground. They're not quite bad enough for all services, but we don't know what to label them as. We don't know what to call them. We don't know. And we've talked about that in pediatrics for years, is what is going to happen to these children who have neonatal substance exposure? What will happen to them? And society's figuring that out. We're seeing it rather than being ahead of it.
Right.
I think just to kind of piggyback on what Mary was saying, I mean, we look a lot at both the mental health and physical health repercussions of trauma. I mean, we know like toxic stress not only can affect kids, in terms of depression, anxiety, risk for, suicide, self-injury, those types of things, but also, on more what we tend to think of like medical type issues. I mean, they're more at risk to be smokers. They're more at risk to engage in substance use themselves. Like life expectancy can be decreased. There's a lot of physical health issues that kind of tie into that exposure. So you're kind of dealing with it at both ends. You have all of those things, in terms of mental health, learning issues, things that make it difficult for them to function in a school setting, but they also have physical health issues too, because of the instability and the exposure to trauma and toxic stress because of some of the things that might be going on in their home environments.
Lori, before we move on, you have anything to add to that?
No, just everything they say is what I see. It's the same thing.
So let's talk a little bit about how do you partner as a school and a school-based health center to try and keep these kids from falling through the cracks?
I think that's probably the most important partnership that you can have. It's not only because I'm an outside entity that is here in the building, but the valuable resources that we have here. I have a school nurse who sees them every other day or every day, depending on what the hours are for the school nurses, because not all schools have school nurses full time. They learn different things about families than I know. So, whereas if I was sitting in a primary care setting, I might see the child maybe with a parent or a guardian or someone. Seeing them within the school setting allows me to see them amongst their peers, allows me to hear what teachers have to say about students, allows me to hear what counselors think about students. It allows me a whole different view of what is going on with that child. And so it's so important to sit down and talk. That's why we have agreements to be able to speak to each other confidentially about a child. Because sometimes I've seen this child, I may have seen this child from birth. So I have those first years that the school doesn't get. And then they have maybe the elementary years. And then maybe I pick them back up in middle school because they went to a different elementary than what I'm working at. And so the things that transpire with children throughout those years is so important to learn, because then we know how to manage them as they go on through school. So it's a huge partnership to be able to have everybody be able to talk to everybody, to be able to have the entire picture of what's going on in that child or that family.
That's a great point.
I think too, it can sometimes be challenging because we're two different systems. We've got a school system and a healthcare system, and we don't have necessarily the same cultures. We don't always do things exactly the same way. But I think, for us having stability of having, being in the school on a regular basis, we're actually here physically, we can build those relationships with our teachers, our nurses, our counselors, our administrators. And like at the end of the day, I think we have that common mission of we really want what's best for these kids. And so that helps us because we have those relationships and we have that understanding. It helps us to navigate some of those challenges of being in two different worlds in some ways.
Right. So I think that's an important point that maybe people don't realize is that you're under the same roof, but not the same umbrella. So you run very differently. And that can be challenging sometimes. But I remember Mary telling me years ago, because you were working at that time in a very large school, and I said, how do you keep on top of, all of these kids? There are, Riverside is a very large school. And you said, well, I don't have to stay on top of what's going on in all the kids. There are some kids who have their own providers and they've got their own lives. And I'm never going to know who they are. But, I stand in the hall and I look for the kids who perhaps need us. And I build relationships with them. And I thought, that's really kind of one of those benefits that people don't realize of a school-based health center.
Yeah, if they see me out and about, I once had a kid tell me that. He said, I see you out in our hallways and throughout the lunchroom and more than I do some teachers. And I said, well, that's my job. My job is to be here and to see what's going on within the population, to know what I need to do for the population. Because we not only take care of their medical needs, but education needs. Maybe there's something that I can do around suicide awareness, or maybe there's something I can do around nutrition. So I try to talk to kids and really learn what it is they want information on, learn what their needs are. So yeah, I may not ever see them as a patient, but most of the time kids know me when I'm out in the hallway. They see you at the grocery store. You know, so I'm out and about a lot, and that's because I need to know what's going on within the population.
That is a great point. Margie, I want to ask you, since we talked often, I'm working on a research project. We talked about mental health, and stigma came up a lot. Do you run into stigma a lot? Is it a problem getting parental consent forms signed? And do you have to make any special efforts to get consent to work with kids?
I would say that I run into those issues sometimes. I would say it's probably not maybe as often as I would expect. And I think it's because we've been here and because we're under the umbrella of Cabin Creek, and Cabin Creek is primary care. We're not necessarily seen as, you're going to the mental health agency. This is just a healthcare clinic and I'm just somebody that works there. So I think that kind of helps if, their primary care provider says, hey, I've got this person in my clinic and I think this would really help your child. I feel like parents are more willing to kind of be open to that. So I will say that I might run into it from time to time, but I feel like being connected with primary care helps, and also being connected with the school, because the referrals that I'm getting, it's being recommended by school counselors, it's being recommended by their medical provider. And these are probably people that parents already have a relationship with. And so it's not necessarily the same as kind of getting, sent to Charleston to see a psychiatrist or to see a, behavioral health agency. So I feel like I have more of an in that way. I think in terms of like students, I don't see a lot of stigma. I think for the most part, they are pretty happy to be coming here. Every now and then I have kids that feel a little uncomfortable talking about what's going on in their lives at school, and I may refer them outside if they just don't have that comfort level. But for the most part, I think there's that comfort for students too, because this is a familiar place. This isn't like unknown. There's not really anything scary about it. They may have been in to see somebody because they needed a Band-Aid or, had to get a flu shot. So I think all of that kind of helps to provide that accessibility, both with parents and with students.
So here's a good question. Do you think that you are adequately providing all the health care, including mental health, that the students need? And if not, what would it take for that to happen?
I would like to say, there's so many more levels of care needed, so much more that's needed. I think we all do the very best we can, but in terms of mental health services, it is kind of like outpatient and then hospitalization, and there is really no accessibility for anything in between. And there are a lot of kids who need more services. There are a lot of kids who need family wraparound type services. And for whatever reason, that isn't accessible. That's not happening. So, I think I don't like to turn kids away. I try to do what I can. But there are lots of kids who need lots more. And I think it's not just because of being in a school-based setting. I think there's just a huge need for more services everywhere in West Virginia. There has to be some intermediary between, going to the hospital and having, a visit every 2 weeks. There's kids that just need more than that. And then you kind of get the kids that come back from the hospital and there's no step down, there's nothing in between. So I think there's a lot more that's needed. There's a lot more specialty services that are needed. Lots more, specific parent training, behavior disorder type interventions, lots of day treatment. We don't have any options for things like that. Specialty services for eating disorders. We have an eating disorder clinic in Charleston, but just the needs for all of those things. Autism services, huge need. So I would love to say that we've got enough, but I can't say that we've got enough. We don't have close to enough.
And the same thing goes for medical. Like you mentioned earlier that in the earlier years, I talked about obesity. So chronic disease management, these are the same children that can't get to one specialist in Charleston. That's like sending them across the country. So, and if there's only one specialist, they might only be able to take a handful of the kids to take care of that. But there's so many things that we could tackle with children and to help be preventative toward adult years. There are chronic diseases that they now have, and some of that's from their trauma, because we know that traumatized children end up with more chronic diseases. Their asthma is usually worse. They tend to have more blood pressure issues, heart issues, weight issues. So being able to tackle more of that without sending them across the country would be awesome. But yeah, I can definitely say I can't tackle it all. We do the best we can and try to prevent what we can and try to educate as we go. But no, we definitely don't have enough.
We need so much more, not only, of course, what they've said, but in the school system as well. Schools aren't used to doing a lot of medical care or having to deal with a lot of health issues. Through history, it hasn't been something that schools have taken care of. And now, because of the opioid crisis, it is. We have to take care of mental health issues, and we have to take care of a lot more physical issues than ever before. And schools are all based on education, and of course, because that they are schools, but there has to be more room for the medical and the behavioral health in entities like the Department of Education. There has to be more support, and there has to be more in the schools to really be able to help these children.
So you're talking specifically, we need more school nurses, we need more counselors, and we need more school psychologists as part of a continuum of care where we need more across the board.
Right.
Is that what you're saying? Yeah. So as an advocate, one of the things that I find most disconcerting is that there's no map anywhere of where all of these pediatric providers are, right? So if you talk to a legislator and you say, we need to improve our network of healthcare for kids, where do you start, right? You all are talking about not even having providers in Charleston, which is the most populated city. So where do you go? I mean, where do you begin on in, prioritizing how to go about improving the healthcare system for kids?
That's a good question, and I don't know that I have an answer to that one.
I wish I knew.
Well, I think more school-based health centers is a good start, because you're alleviating a lot of challenges, such as the transportation issue, which is one of our biggest. Schools, kids are a captive audience. And you also do get the opportunity to cultivate relationships with family members who may not be very trusting of a child accessing healthcare. So I think that's very important. And I think that when we talk about that pediatric network, we can't just think of primary care. We have to think of mental health care, and we also have to think of accessibility to, a pharmacy and all of those things. Because I think, Lori, I'm remembering a few years ago, you had contacted me and said that a provider in Charleston was gone, and you were concerned about how students were going to get their prescriptions filled.
Right. That was with some of the ADHD medications that they needed, because there wasn't a provider, and let alone the fact that the child has to go into town every month to see the provider to get the prescription written was just impossible. And without this, the student was always in trouble in school. And that's when the School-Based Health Center and Mary and Margie stepped in and brought in a psychologist who could see the student once a month and other students, and actually write and prescribe the ADHD medicine that was needed. I would go pick the prescription up myself because I knew that the parent wouldn't, and we would keep it at school to make sure that it was given when needed. And it worked great for that student. So that it is a problem. We don't have a lot of doctors in Charleston, especially pediatric specialists. And if you do need to see one, you're talking like at least 6 months of a wait time. So, and a lot of our kids need specialists, don't you think, Mary, medically?
I do. Like we have more chronic diseases, and again with the opioid crisis and the substance abuse intrautero, it's hard to determine what is trauma, concentration, and ADHD, and what that whole thing looks like, and exactly what to call that. But do they have problems with concentration, and could they be ADHD? Yeah, they could. But they could also have had all this other exposure in there, and they look a lot alike when you really get into the weeds to try to figure it all out. And then if we want to go have them psychologically tested somewhere, that's a little bit of a wait time. Sometimes insurance doesn't pay for that. And then again, sometimes we just don't know what to call it. It's this mix of stuff. And how do we treat that? And so sometimes it takes specialists, but there's not a lot of pediatric specialists to be able to pull in. And then, like you said, they have to go off to Charleston every month, and then without the transportation, then they miss appointments. And unfortunately, in our healthcare system, sometimes when children miss appointments, be it no fault of their own, then they can't go back to that provider. That provider won't see them anymore. So then what? Primary care doesn't take it on, or somebody else doesn't step up, or if we can't bring it into the school, or the child goes without.
Yeah, I think whatever we could do to bring more specialists to access like school-based students, like Lori had mentioned, we had our psychiatrist who was able to travel out here once a month in our pre-COVID world. And that really allowed some students who never would have been in front of a specialist, that they were able to access that service. And I think, you know, not just with psychiatry. I mean, I think there's a lot of kids that, I mean, maybe they get referred to dermatology, or maybe they get referred to cardiology and they don't make it to those appointments. And then, you know, there's just no follow through. So, you know, any means of getting the care in the school, like whether it's once a month or telehealth or however, like we could increase that access, because, you know, I just have found, I mean, even when, you know, I've had to refer kids out, you know, for more intensive services outside of school for behavioral health visits, a lot of times they don't make it. So if they don't see me, they don't see anyone. And so you'd like to have them get to a higher level of care, but that just isn't going to happen. So whatever we can do to bring it to the school, I think it really increases the likelihood that that child's going to get seen and going to have that service.
I even have diabetic patients, type 1 patients that can't, their parents don't get them to the pediatric endocrinologist. And I can call and ask for them to change orders, you know, if I see a trend in their blood sugars, and they may once or twice, but after they've missed so many appointments, like Mary said, they stop seeing them. And then where is this child, and who's taking care of them?
That's a good point. I'm going to mention one more thing, and then we have a question from someone who says, are you all familiar with the Communities in Schools program? Is that in your area?
I'm familiar with it. I know it's very strong in Greenbrier County, but it is not in our area. No.
I think that there are a couple. I want to say Raynell Medical Center is a school-based health center that's affiliated with Communities in Schools. So maybe we'll do something to talk with them at a later date. But I think that something that we need to touch on before we're at the top of the hour is the sustainability of how the school-based health centers stay afloat. So not all school-based health centers in our state and across the country have been viable because they're not money makers. And most of the school-based health centers, not all, but most school-based health centers in our state are federally qualified health centers. And so there's, you get a bit of a higher reimbursement rate from Medicaid, and you have a sliding scale fee, but actually Cabin Creek does not charge, am I correct on this, does not charge copays to families if a child is seen in the school-based health center.
That's correct. We see patients without insurance, we see patients with insurance. So whatever the need is, we see it.
Gotcha. So that makes it much more affordable.
Yes. But it also makes us not that profitable. Like we're not like a regular primary care setting or a private facility. Because if you don't have insurance, most of them aren't going to see you. If you need something, we're going to take care of you. So that makes us a little more vulnerable.
Yeah, so I said that to say this. I'm a big proponent, you all are big proponents of expanding the school-based health center model. So if we had legislators or policymakers watching this right now, what is it you would like for them to know about school-based health centers and whether or not you think that they need to be expanded? Whether that be more school-based health centers or the availability for you to provide more services.
I would say come out and spend the day, a couple days with us, and you won't have any questions whatsoever that more services are needed and more school-based health centers are needed and more funding is needed for this. And even if the child doesn't have insurance and the school-based health center sees them, that doesn't mean we can always continue their care. I have one right now that needs an inhaler, but mom has let Medicaid drop. So we can't get him his inhaler. So it doesn't just stop there with that. But back to the legislatures, I think if they came and spent a day or two with any of these ladies, they would know in a heartbeat that it's so needed. I don't know if all the statistics that everyone has show this, but I'm sure they do if they really looked at them close enough.
Yeah, go ahead, Mary.
Oh, that's good. Go ahead.
Oh, I was just going to say, I mean, I would agree with Lori. I think if you could spend a day in a school to see what challenges just present teachers and administrators, I mean, it is a totally different environment than I remember, in my schooling. Just the needs. I mean, you don't have one or two kids in a classroom with needs. You have significant portions of a classroom. And so it just makes everyone's work more difficult. And I think that's why, I feel like this job is so rewarding being in the school because I'm getting services to kids who would never get it. And I think, we put a lot of work into it. We build relationships with these kids. And then when you see the kid that in 10th grade, you thought there's no way this kid's going to graduate. And then they get to the end and they graduate and they know who their doctor is going to be as an adult. And they have a plan for seeing a mental health professional and they know how to advocate for themselves. Like it might not be profitable always, but I think the value to these kids' lives in terms of making them into more successful adults, giving them a chance at life. I mean, you can't put a dollar amount on that to have a functional adult at the end of at the end of high school, that they have a chance at getting out in life. And I mean, we don't do it all, I mean, those kids, they are resilient and they put a lot of effort into it and they work hard, but they have a few more adults with a little bit of information that are back behind them trying to move them along. And that I think means more than anything.
I think we need to embroider that on a pillow. That's it right there, Margie.
It is. I was getting ready to say that because if you want, we talk about healthy communities and healthy, productive citizens, and the only place to start that is to start with our children. We can't forget them. It is not their fault that they're in this situation. And if we don't step up and help them, they will never make it to the end. And it's so sad to see children who are defeated before they ever get started in life. And then we wonder what's wrong with our society and what we need to do. We can sit down there and talk about it all day long at the legislature, but Our children need it. And we can't forget them.
I agree. I think that one of the problems that we have, I have seen over the years, people bring kids to articulate, the struggles that they have to legislators, and they kind of respond with this, I went through struggles too, and I picked myself up from my bootstraps. And I don't think that they understand kind of what the world is now as opposed to what the world was like then, and how many just the adversity that the kids are facing, and for the fact that they build such resilience that they can graduate. I mean, that's a real feat. And they know how to access healthcare, which is hard. So I think that is a really exciting thing too. So we are thinking about continuing this, series every few months. What would you like to discuss as school-based health staff in upcoming discussions?
I would like to discuss how we can share information between the schools and the school-based health centers better. I mean, we all communicate fine, but we just found a case this week, Mary and I talked yesterday, of a child that a part of their education and a behavior plan was completely missed and would have made a huge difference in an outcome. But because it was done at an elementary school and not passed on to a middle school, or not passed on through medical files, it was completely missed. So I think we need to look at how we can all share information better, as well as with CPS. We've had that discussion.
Yes, we have, and that is really important. But I mean, I think let's try and contextualize this. So Lori, do you bill Medicaid?
I used to, I can, and I used to, but we don't do that anymore because of the way it was being paid out.
So was it ever electronic that you did it, or did you?
In my dream, no. I have really thick files from billing Medicaid.
So you had to literally take your time after you have all of these students to fill it out to get reimbursed.
Right.
And the files that you have from Medicaid billing, that's not shared with the medical files in the school-based health center.
No.
Correct?
No.
So any kind of information that you may have on the same student comes from the collaboration between the two of you, and ensuring that you're, kind of sharing information following HIPAA and FERPA.
Correct.
So just in that little silo, you've got all of these challenges.
Mm-hmm.
Yeah. And then when you start talking about CPS, they have their own way of doing things. And yet there's, I was just looking at data, I think it came out last month, that we have the second highest rate of child maltreatment in the country. And so that I am quite sure from looking at the statistics, is we've seen a 38% increase over the last 5 years of child maltreatment. That it has, the opioid epidemic has probably played a critical role in that as well. And so it's all connected except our systems.
Yes. Yes.
Okay, well, I think that we're at the top of the hour. Any last words from Margie, Mary, or Lori?
Thank you for this discussion, because I think it was well needed. I think people need to hear what happens, and I think we need to fund it more.
I hope so. I think that we can at least elevate the work that you do, in the hopes that when we finally start talking as a state in ways that we can improve the lives of these kids, that we look at school-based health centers as a cornerstone in ensuring they get access to healthcare. With that, thank you, Lori, Mary, and Margie, and I will see you all soon. Thanks everyone who has watched. And the video will be up tomorrow on our YouTube channel, and we'll have some links to some of the issues, and of course, Cabin Creek Health Systems, school-based health centers on our YouTube channel. Thanks, everyone. Have a good day. Bye-bye.